Bacteria vaginosis, causes, diagnosis and treatment. Bacterial vaginosis (BV) is a type of vaginal inflammation caused by the overgrowth of bacteria naturally found in the vagina, which upsets the natural balance. Normally there is a healthy mix of millions of friendly germs, bacteria, in our bodies, including in the vagina. We rely on them being there and they are a part of what keeps us healthy. In bacteria vaginosis, the balance of vaginal bacteria is altered. The type of bacteria called anaerobic bacteria that grow in an environment without air, increase in number, whilst another type, called lactobacilli, dies off. This disturbance in the bacteria makes the inside of the vagina slightly less acidic than usual. This slight reduction in acidity then encourages the growth of more anaerobic bacteria and fewer lactobacilli. Women in their reproductive years are most likely to get bacterial vaginosis, but it can affect women of any age. The cause isn't completely understood, but certain activities, such as unprotected sex or frequent douching, increase your risk. Symptoms. Bacterial vaginosis signs and symptoms may include thin, gray, white or green vaginal discharge, foul-smelling fishy vaginal odor, vaginal itching, burning during urination. Many women with bacterial vaginosis have no signs or symptoms. Causes. Bacteria vaginosis is not caused by poor hygiene. In fact, excessive washing of the vagina, particularly if strong soaps or perfumed deodorants are used, may alter the normal balance of bacteria in the vagina even more, which may make BV more likely to develop or worsen. You are likely to get bacterial vaginosis if you are sexually active, most especially if you have multiple sexual partners or a new sex partner. Bacteria vaginosis isn't a sexual transmitted infection, so it can also affect women who aren't sexually active. If you have a past history of sexually transmitted disease, on intrauterine contraceptive devices, IUD. If you douche, have prolonged or heavy menses, following hormonal changes. Diagnosis. For diagnosis, a sample of your vaginal discharge is collected and examined under the microscope to check for clue cells, vaginal cells covered with bacteria that are a sign of bacterial vaginosis. Also, your vaginal pH is determined by placing a pH test strip in your vagina. A vaginal pH of 4.5 or higher is a sign of bacterial vaginosis. A pelvic exam is also done where your doctor visually examines your vagina for signs of infection, and inserts 2 fingers into your vagina while pressing on your abdomen with the other hand to check your pelvic organs for signs that may indicate disease. Treatment. Oral antibiotics are the first choice treatment. Your healthcare professional will prescribe the necessary one for you after diagnosis. Also, vaginal creams and gels can be prescribed for topical application. In addition to medical treatment, avoid the use of douches, vaginal deodorants, bath additives and harsh soaps. Refraining from intercourse for a couple of weeks, or using a condom and a water-based lubricant, can be helpful. Taking probiotics such as yogurt has also shown to be helpful. Complications. Bacterial vaginosis doesn't generally cause complications, but sometimes, having bacterial vaginosis may lead to preterm birth, sexually transmitted infections, infection after a gynecological surgery, pelvic inflammatory disease, recurrent infection. Bacteria vaginosis often recurs, usually within a few months of treatment. If you keep getting BV symptoms, your doctor will do some tests to be absolutely sure you have got BV and not any other infection. If it turns out to be definitely BV, a different antibiotic to the one you have taken previously may be tried. Occasionally, regular preventative use of an antibiotic vaginal gel may be advised. If you are using an IUD for contraception, it may be advised that you consider having this removed. Thanks for watching.